Ever feel like there's this massive, ocean of knowledge out there just waiting to be explored?
Totally.
And you just want to dive in and discover all these incredible, fascinating things.
Well, that's exactly what we do here on the All Sorts podcast. We're like a crew of curious explorers charting those uncharted waters of information.
Yeah, and we invite you to join our expedition.
Exactly. So hit that subscribe button on YouTube. It's like fueling your mind's voyage.
And while you're at it, share the knowledge you discover with your fellow learners. It's like bringing back treasures from your explorations.
And don't forget to ring that notification bell,
so you never miss our next deep dive.
Right. Speaking of deep dives, we've got a particularly fascinating one for you today.
We're going deep into the world of a medication called Valproate.
And we've gathered a whole bunch of sources for this one, like practical guides, in-depth summaries of how it works in the body, its pharmacology, its Wikipedia entry, a StatPearls monograph, even a comprehensive pharmacology overview. We've got it all. We're aiming to give you a clear understanding of what Valproate is used for, how it interacts with your body, and some things to keep in mind if you or someone you know is taking it.
Yeah, we want to make it insightful, but without overwhelming you with too much detail.
Absolutely.
So, first things first, Valproate seems to come in a lot of different forms, like slow-release tablets, capsules, even liquid. Why so many options?
Well, it really comes down to individual needs and also minimizing potential side effects. Those slow-release formulations, for instance, they release the drug steadily over time.
Okay. So it's not just about what's easiest to swallow?
No, it's about how it gets into your system. See those big spikes in droxin concentration you can get with some medications? Those can sometimes be linked to unwanted effects.
That makes sense. What about the gastro-resistant tablets? Those sound interesting.
They are. They're designed to bypass the stomach and dissolve further down in the intestine. This is really helpful for folks who tend to get an upset stomach from other oral medications.
So it's all about optimizing how the drug interacts with your body, minimizing the chances of stomach upset.
Exactly.
Then there are the crushable tablets and the liquid form. Those seem like they'd be more about ease of taking the medication.
Right. They're especially helpful for people who have a hard time swallowing pills, or in cases where you need a very specific, very precise dose.
Now, when it comes to actually taking Valproate, should people be mindful of food?
The general advice is to be consistent. Whether you take it with food or without food, try to stick to the same routine every day.
So don't switch it up.
Right. Changing things up can affect how your body absorbs the medication. Think of it like baking a cake. You don't want to change the recipe every time if you want consistent results.
And just like with many other medications, especially for ongoing conditions, it's really important not to suddenly stop taking it without talking to your doctor first.
Absolutely. All of our sources emphasize that. Suddenly stopping Valproate can cause the underlying condition to come back or even get worse, whether it's seizures, bipolar symptoms, or migraines.
Right. There is also specific advice for breastfeeding mothers. What's the key takeaway there?
Well, breastfeeding has so many benefits for both mom and baby, but mothers who are taking Valproate do need to be extra vigilant and monitor their babies closely.
For what kinds of things?
Things like if the baby isn't feeding well, that there's any unusual bruising, any yellowing of the skin or eyes, especially on babies with darker skin tones where it can be harder to notice, dark urine, or pale stools.
Got it. So anything out of the ordinary, basically.
Exactly. If anything seems off, reach out to a healthcare professional right away. It could be nothing, or it could be something that needs attention.
Okay, important advice. Now let's talk about what Valproate is actually used for. It seems to have quite a range of application.
It does. It's what we call a broad-spectrum therapeutic agent, which means it's effective against a number of different conditions.
Okay.
One of its primary uses is in the treatment of epilepsy. It's effective against various types of seizures, including absence seizures, complex partial seizures, generalized tonic-clonic seizures, myoclonic seizures, and even status epilepticus, which is a serious condition where seizures are prolonged or happen repeatedly.
So for epilepsy, it's pretty versatile.
Very much so.
What about other uses?
It's also used quite extensively in managing bipolar disorder.
How does that work?
Well, it's used to treat acute manic or mixed episodes, as well as acute depressive episodes. It acts as a mood stabilizer, helping to prevent those extreme highs and lows that characterize bipolar disorder.
So it helps to keep things on a more even keel.
Exactly. Sometimes it's even used as an alternative to lithium, which is another medication used for bipolar disorder.
Interesting.
Now, it's worth noting that the American Psychiatric Association guidelines often recommend lithium or Divalproex, usually alongside an atypical antipsychotic, as the first-line treatment for severe manic episodes.
I see.
But Valproate is still a key player in managing bipolar disorder.
Got it. So we've got epilepsy, bipolar disorder, any other conditions where it's commonly used?
Yes, another important application is for migraine prophylaxis.
What does prophylaxis mean?
It means preventing the migraines from happening in the first place.
Oh, I see. So not treating them once they've started, but actually trying to stop them before they start.
Exactly. We don't fully understand how it works for migraines, but it's thought to involve stabilizing nerve activity and limiting the transmission of those pain signals in the brain.
Fascinating. And I think I remember reading something about uses in children as well.
You're right. In kids, Valproate has been studied and used for managing bipolar mood disorder and conduct disorder, especially for addressing things like irritability, aggression, and impulsivity.
It seems like there's still a lot of research going on to see what else Valproate might be useful for, too.
Absolutely. There's research looking into its potential in cancer therapy and also as an adjuvant therapy, which is a supportive treatment used alongside the primary treatment.
For what kinds of conditions?
For conditions like HIV, cancer, and neurodegenerative diseases. The reason for this interest is that Valproate is a histone deacetylase, HDAC, inhibitor.
What does that mean?
It means it can affect how genes are expressed within cells, which is pretty significant.
Yeah.
But it's still early days in terms of research.
Okay, so we've talked about what Valproate is used for, but how does it actually work in the body? Like, what's going on at the molecular level?
That's where the pharmacology comes in. And here's the thing about Valproate. It doesn't just have one mechanism of action. It has several.
Interesting.
One of its key actions involves increasing something called GABAergic transmission. GABA, or gamma-monobutyric acid, is a neurotransmitter that acts like a brake on nerve activity in the brain.
A brake?
Yeah, like slowing things down, preventing those neurons from firing too much, which can lead to seizures.
I see.
So Valproate is thought to increase GABA levels in the brain, enhance how well GABA receptors work, and it might even mimic the actions of GABA itself.
So it's like boosting the brain's natural calming mechanisms.
That's a great way to put it. And then on top of that, it reduces the release and the effects of something called excitatory amino acids. These are neurotransmitters that can overstimulate nerve cells, contributing to all that neuronal hyperactivity.
Right.
So by dampening their effects, Valproate helps to stabilize brain activity. And there's more. It also blocks something called voltage-gated sodium channels in nerve cells. These channels are essential for transmitting electrical signals. By blocking them, Valproate can help prevent the rapid, uncontrolled firing of neurons that you see in seizures. And finally, it also seems to affect the activity of other important neurotransmitters like dopamine and serotonin, which probably contributes to its effectiveness in treating bipolar disorder and possibly even in migraine prevention.
Wow, it's working on so many different levels. It's amazing that one medication can do all that.
It is fascinating. It suggests that conditions like epilepsy, bipolar disorder, and migraines, even though they seem so different, might share some common underlying pathways that Valproate is able to influence.
That's a really intriguing thought. So let's say someone takes a dose of Valproate. What happens next? How does it get absorbed? Where does it go in the body?
When you take Valproate orally, it gets absorbed into your bloodstream fairly easily. But the amount that actually gets into your system, which is called bioavailability, that can be affected by the specific formulation you take and also whether you've eaten anything, especially fatty meals.
Fatty meals.
Yeah, fatty meals can actually increase the bioavailability and also the time it takes for the drug to reach its peak concentration in your blood. It's like the fat helps the drug dissolve and get absorbed more effectively.
Interesting.
And as we talked about earlier, the different formulations like immediate release, delayed release, extended release, they all affect how quickly the drug gets absorbed and what those peak concentrations are. Think of it this way. Bioavailability is like how much water actually gets to the roots of a plant, while the peak concentration is like the biggest splash of water you give it at any one time.
Okay, that makes sense.
Different formulations are designed to control both of these.
Once the drug's in the bloodstream, how does it get around the body?
Once it's absorbed, a lot of it binds to proteins in your plasma, mainly albumin.
Okay.
This is called protein binding. And for Valproate, it's around 90%. But here's the interesting thing. As the concentration of Valproate in your blood goes up, the percentage that's bound to protein actually goes down a little bit.
Why is that?
Well, only the free drug, the drug that's not bound to protein, can actually do its job in the body. So the protein binding acts like a kind of reservoir, releasing the drug slowly over time.
Oh, I see.
And this is why changes in other medications that also bind to protein can affect how much Valproate is actually active in your system.
That makes sense.
Now, Valproate is also able to cross the blood-brain barrier. That means it can get into the cerebrospinal fluid, which is the fluid that surrounds your brain and spinal cord. That's where it has its main effects on the central nervous system. And it also crosses the placental barrier, which means it can get to the developing baby during pregnancy. The baby's Valproate concentration can be pretty much the same as the mother's, which is why it's so important to be careful about taking it during pregnancy.
We'll talk more about that later.
Sounds good. And just so you know, it also gets into breast milk at levels similar to what's in the mother's blood plasma.
So it really does travel throughout the body. What about how it gets broken down? How is it metabolized?
The liver is the main site for Valproate metabolism. It goes through several different metabolic pathways. The most important one is called glucuronidation.
What happens in glucuronidation?
It basically gets attached to a molecule called glucuronic acid, forming something called Valproate glucuronide, which is generally inactive. It also goes through mitochondrial beta oxidation and oxidation by enzymes in the cytochrome P450 system, specifically an enzyme called CYP2C9. And here's something important to remember. Some of the byproducts of Valproate metabolism actually have anticonvulsant activity themselves.
So they can help with seizures too.
Exactly. But some of the byproducts can also contribute to side effects. That's why it's so important for doctors to consider all the other medications someone is taking, because Valproate can interact with those drugs, especially if they're metabolized by the same liver enzymes.
Right.
It's all about understanding those metabolic pathways.
Okay. So last question about the ins and outs of Valproate in the body. How does the body get rid of it?
Primarily through the kidneys. It's mainly excreted in the urine as metabolites, with about 30 to 50% of the original dose being excreted unchanged.
Okay.
Now, the rate at which it's eliminated can actually depend on the dose. At higher doses, it follows what we call zero-order kinetics, which means a constant amount of the drug is removed per unit of time. But at lower doses, it follows first-order kinetics, which means a constant proportion of the drug is eliminated per unit of time.
That's a bit complicated.
It is a bit technical, but the key thing to know is that the elimination rate can vary.
Okay. And what about the half-life?
Yes. The half-life, which is the time it takes for the concentration of the drug in your body to decrease by half, that's typically around 9 to 18 hours in adults. But this can be shorter, like 5 to 12 hours, if someone is also taking medications that speed up liver enzymes. Those medications are called enzyme inducers.
I see.
And while Valproate itself isn't an enzyme inducer, it can actually inhibit the metabolism of certain other drugs. So it can actually cause the levels of those other medications to increase in your system.
So it can work both ways.
Exactly.
That was a really thorough explanation of how Valproate works in the body. Now, let's talk about what people can expect when they start taking it, and what are some things to consider in terms of its effects?
Sure. First of all, it's important to have realistic expectations. It usually takes a few weeks for Valproate to build up to a therapeutic level in the system and for you to really notice its beneficial effects.
So it's not an instant fix.
No, it takes time. And for many conditions, once the symptoms are under control, treatment with Valproate often needs to continue for years to maintain that stability.
I see. Is there any concern about becoming dependent on it? Like, is it addictive?
No, Valproate is not considered to be addictive.
Okay, that's good to know. What about interactions with other things like recreational drugs or alcohol?
There can be interactions. If someone uses recreational drugs like cannabis or heroin while they're taking Valproate, it might increase their risk of experiencing side effects, things like panic attacks, anxiety, or memory problems.
Right.
And with alcohol, drinking alcohol while taking Valproate can make you feel more sleepy or tired. So it's generally best to be cautious, especially when you're first starting the medication, to see how it affects you.
And there's the issue of driving, particularly for people who are taking Valproate for epilepsy.
Absolutely. Driving regulations for people with epilepsy are there to ensure public safety. Generally, people with epilepsy shouldn't drive until they've been seizure-free for a certain period, often a year, or if they only have seizures while they're sleeping. And if someone's epilepsy medication is changed, including Valproate, their doctor will advise them on whether they need to stop driving for a while and for how long.
Right, so always consult with your doctor.
Always.
We talked about the different formulations of Valproate earlier, but are there any other medications that are similar to it that people might come across?
Yeah, there's valproic acid and semisodium valproate, which is also known as divalproic sodium. They're very closely related to sodium valproate.
Oh, so...
They essentially work the same way, but they might be prescribed at slightly different doses or for slightly different reasons.
Okay.
For example, divalproex sodium is a combination of sodium valproate and valproic acid, and it's sometimes preferred because it might cause fewer gastrointestinal side effects for some people. And then there's magnesium valproate, which is another one available in China. At a chemical level, valproate is the negatively charged ion, valproic acid is its protonated form, sodium valproate is the sodium salt, and divalproic sodium is a stable coordination compound of valproic acid and sodium valproate. So they're all variations on a theme.
So they're all related, but might have subtle differences in how they're used or tolerated?
Exactly.
Now, I'm sure there are situations where Valproate is not the right choice for someone. What are those? What are the contraindications?
There are several conditions where valproate should generally be avoided. For example, if someone has a pre-existing liver problem or a family history of severe liver inflammation, especially if it was related to medication, that would be a contraindication.
Right.
And pregnancy is a big one.
Because of the risk of birth defects.
Exactly. There's an increased risk of birth defects and neurodevelopmental disabilities in the baby. And of course, if someone has a known allergy to valproate or any of the ingredients in the medication, they shouldn't take it.
Makes sense.
There are also some metabolic disorders where valproate is contraindicated, things like urea cycle disorders and hepatic porphyria, and a history of liver damage specifically caused by valproate, mitochondrial disease, pancreatitis, and other types of porphyria.
Okay, so there are quite a few situations where Valproate is not a good choice.
Yes, it's not for everyone.
You mentioned pregnancy risks, and those sound pretty serious. Can you tell us more about those?
Yes, the risks are significant. There's about an 11% risk of major birth defects and a 30 to 40% risk of neurodevelopmental disabilities in children who are exposed to valproate during pregnancy.
That's a pretty high risk.
It is, and this is often referred to as fetal valproate spectrum disorder or syndrome, or FVSD-FVS.
And what kinds of problems can that cause?
It can manifest in lots of different ways, like cognitive impairments, developmental delays, autism spectrum disorder, ADHD, and various congenital malformations. Neural tube defects, like spina bifida, are a major concern. Because of these risks, valproate is definitely not recommended for preventing migraines in women who are pregnant.
So the risks are just too high.
They are.
What about if someone is breastfeeding?
Valproate does pass into breast milk, so it's a decision that needs to be made carefully, weighing the benefits of breastfeeding against the potential risks.
Right.
In some cases, the benefits of breastfeeding might outweigh those risks, but it's crucial to monitor the baby closely for any possible side effects.
Like we talked about earlier.
Exactly. Things like sleepiness, irritability, difficulty feeding, weight loss, bruising, yellowing of the skin, changes in urine or stool color.
And those risks might be higher in younger babies.
Yes, and in babies who have other health issues.
So always talk to your doctor.
Absolutely.
Now let's talk about the potential side effects that people might experience while taking Valproate.
Sure. Some of the common side effects, they're generally not severe, but they can be annoying. Things like nausea, vomiting, diarrhea, tremor, often in the hands, weight gain, headache, increased bleeding time, low platelet count, hair loss, fatigue, sleepiness, and dizziness.
Okay, those are the common ones. Are there any more serious side effects that people should be aware of?
Yes, there are some more serious ones that, while less common, do require immediate medical attention if they occur.
Like what?
Things like serious liver problems, also known as hepatotoxicity. This is a particular concern for young children under 2 years old, individuals with mitochondrial disease, and those who are taking multiple anti-epileptic drugs.
Okay.
Another serious risk is pancreatitis, which is inflammation of the pancreas. And as we've discussed, there's the risk of birth defects if it's taken during pregnancy.
Right.
Other potential serious effects include hyperammonemia, which is high levels of ammonia in the blood, and problems with blood clotting because of platelet disorders. In fact, there are what are called black box warnings issued by regulatory agencies about the risk of hepatotoxicity, mitochondrial disease, pancreatitis, and teratogenicity, which is the potential to cause birth defects. These warnings highlight how serious these potential problems can be.
So it's really important to be aware of these and to contact your doctor if you notice any signs of these side effects.
Absolutely. Early detection is key.
You mentioned something earlier about potential effects on the endocrine system. Can you tell us more about that?
Sure. That's actually a very interesting area of research, and we're still learning a lot about it. Valproate has been found to interact with the endocrine system in a few ways. For example, it can act as an antagonist of androgen and progesterone receptors.
What does that mean?
It basically means it can block the actions of those hormones.
Okay.
It can also inhibit aromatase, which is an enzyme that's involved in the production of estrogen.
I see.
These actions might be linked to some of the reproductive endocrine problems that have been observed in some people who take Valproate. Things like hyperandrogenism, which is increased male hormones, and polycystic ovary syndrome, or PCOS, in women.
So it can have some pretty wide-ranging effects. It sounds like regular monitoring by a doctor would be really important for anyone who's taking Valproate.
It definitely is. Regular checkups are essential. Doctors typically recommend regular blood tests, like liver function tests, a complete blood count to check those platelet levels, coagulation tests to assess bleeding risk, and ammonia levels.
And how often would those tests be done?
It depends, but often they're done more frequently during the initial months of treatment and in certain patients who might be at higher risk for side effects.
Makes sense.
There are also established therapeutic ranges for Valproate levels in the blood, both for epilepsy and for mania. Doctors will monitor these levels to make sure the medication is effective and to minimize the risk of side effects.
Okay. What happens if someone overdoses on Valproate? How is that managed?
Well, the first thing is to stop the medication and provide supportive care to keep the person stable and address any complications that arise. In more serious cases, they might consider using techniques like hemodialysis or hemoperfusion, which help to remove the drug from the body more quickly. And there's also a specific treatment using L-carnitine that might be used, especially if there are changes in mental status or high ammonia levels.
So there are options, but obviously it's best to avoid an overdose in the first place.
Absolutely. Prevention is always better than cure.
Valproate really is a fascinating medication, but it's clearly complex and powerful and needs to be used carefully and under the supervision of a doctor.
Definitely. It makes you think, though. Given how many different neurotransmitters and physiological processes Valproate affects, what does it tell us that it can be effective for such seemingly different conditions like epilepsy, bipolar disorder, and migraines?
That's a great question.
It raises all these questions about what the underlying mechanisms might be that connect these conditions. There's still so much to learn.
That's so true. And that's what we love about the All Sorts podcast. There's always something new to explore, some new mystery to unravel. And we want you to be a part of the journey. So if you enjoyed this deep dive into Valproate, hit that like button, subscribe to the All Sorts podcast on YouTube, and ring that notification bell so you never miss an episode.
And don't forget to check out our archive. We've got tons of deep dives on all sorts of fascinating topics.
We're also on X, Instagram, and Threads. Come connect with us and share your thoughts. Your insights help to make the All Sorts podcast even better.
So join us, and let's keep exploring the boundless world of knowledge together.
We'll see you in the next deep dive.